Thank you, Matt. Let me know if you're having trouble hearing me in the back. I'm really delighted to be here this morning, and tough act to follow with Dr. Johnson. We're both on the staff at Holland Hospital, and really delighted to be able to meet with the community in this way. I appreciate the introduction by Matt. Hope everybody's wandering in from their smoke break. Let's see. So we're going to talk about some mind-body stuff today, and I'm actually going to put you to work right off the bat just to make sure everybody's awake and dialed in. Oh, that's a brief bio. The thing that's germane there, I've been a psychiatrist at Holland Hospital for 16 years now. I came here in '94. But the thing I'll underline is where I did my medical education, which is the University of Iowa, also where Dr. Johnson did his training. So you know you're getting the straight scoop today because you've got Hawkeyes delivering it. Okay, so we're going to talk about the head and the heart and mental health connections. And we're going to start by a little exercise that will really dial you in to the fact that you already know this. And so it's Valentine's Day weekend. And what is the most powerful and positive emotion available to all of us? It's love, right? And we're in the holiday that celebrates that. And when you look at the person that's nearest and dearest to you on Valentine's Day, hopefully what you'll say to him or her is, I love you with all my... There you go. So that tells you that it's already there. It's already ingrained in us that there are connections between our heart and our emotional state. So give me some others. Think of another phrase that connects emotion with your heart. I'll start you off. You get scared? My blank is in my chest. Or it's beating in my chest, right? You think of another one? Wearing your heart on your sleeve? That's good. Ah, yes. The anti-Valentine's Day, you broke my heart. Yeah. Sadness. So we instinctively know that our heart is connected very much with our emotions. And we've known this for thousands of years, but we sort of forgot it for a while. And we forgot it for a while because of this man. This is René Descartes, 17th century philosopher. He's also known for developing many of the principles of algebra and geometry. So this is the guy that tortured you in high school. You didn't know you could blame it on him, but you can blame it on him. And what Descartes advocated and believed in is something called dualism, that the body is entirely separate from the mind, that the mind has a life of its own that's very disconnected from the body. And that thinking has really informed Western medicine in the 4 centuries since Descartes. And I like to say that, by taking that position, he's guilty of putting Descartes before the horse. Still awake. Fleeing for the exits, but still awake. So medical research has established connections, and we're just going to very briefly look at a couple of things to support this statement. Between depression and heart disease, and we'll talk about what those connections are. And between other negative emotional states and heart health. So I heard Dr. Johnson referring to the impact of stress. That's very real. And there's a fair bit of research to support that. And specifically, we're going to talk about the impact of anger and hostility. And that doesn't just mean the kind of hostility when your team doesn't win the Super Bowl and you're throwing things at the set, but you're running late for an appointment and you're caught by a train. It's happened to all of us. And what kind of builds up, and the impact of that on our whole physiology, how our body's working. So you can't be a psychiatrist giving a talk to the community without putting in a plug for depression as a medical condition that deserves good treatment. Depression is one of the more common conditions that can affect people at any point in the lifespan. And it's not just a state of mind. It's not just the case of the blues or having a bad day. It actually is a physical and emotional state that affects really every aspect of a person's functioning. So just to go through, so we're all on the same page, what depression is. By definition, it involves low mood or loss of interest and pleasure. Not everybody will use the language of low mood, and particularly older adults sometimes won't. But I'm not enjoying my grandkids anymore. I've given up reading the paper. That loss of interest, loss of pleasure. Sleep problems are ubiquitous. It's rare for me to see somebody who's suffering from depression who says, yeah, but I'm sleeping great. Usually it's either too much or not enough or can't fall asleep. Changes in appetite or weight, either up or down. Loss of energy. Trouble concentrating. Again, I don't think I've ever had somebody that I've treated who's in a depression says, I'm really depressed, but boy, I've never been sharper. I mean, people feel like... for those who've gone through it, they feel like, boy, I just cannot get my mind to focus. I can't work. And then of greatest immediate concern for us is feelings of hopelessness or suicidal thinking. And the thing to point out about this is how very common this condition is. Lifetime, about 16% of people, so close to 1 in 5, will experience an episode of major depression. By the way, we define this. And again, a very treatable condition, but a condition that, untreated, has an impact on one's physical health as well as emotional state and enjoyment of life. So we're going to talk a couple of research slides here to point out some connections that have been made with today's topic. A study in Finland. And this was a long study, 7 years, and a big study, over 20,000 adults. They looked at what their emotional state was at the start of the study. Were they currently suffering from depression? Now, statistically, you have a group that big, you're going to have a few thousand people, actually, who rate for depression. And without getting into the statistics, they controlled for all other factors, smoking, weight, cholesterol, etc. And controlling for all of those other factors, the level of depression at the start of the study predicted how likely it was that this person would have coronary artery disease that would emerge sometime in that 7 years. That connection was directly made, controlling for all other factors. And really established, and this was published within the last 12 months in the International Journal of Epidemiology, and showed a direct connection between depression and coronary artery disease. And the conclusion of the research team was that untreated depression is a risk factor for coronary artery disease. So again, treating depression, good idea just from a quality of life standpoint, but also a real good idea from a general health standpoint because of the impact this has on one's general health. We do depression screening every year through behavioral health services at Holland Hospital. Physicians in this community, family doctors, internists, as a group are very good at assessing this. If somebody comes in with a question, I wonder if I'm suffering from depression. And really the hard thing is getting people to go in and make the appointment and talk to a professional about it. A study that addresses another aspect of this from the Cleveland Clinic. In the 2 years after a myocardial infarction or heart attack, individuals who are depressed have 2 times to 2.5 times higher likelihood of dying than non-depressed patients. And there are probably a number of reasons for this. People who are depressed are not as likely to go to cardiac rehab. They're more likely to engage in behaviors that hinder their recovery. Maybe they don't take the medications prescribed by their cardiologist consistently. Maybe they continue to smoke 3 packs a day rather than working on smoking cessation. But there are actually physical changes that happen as well. Platelets, which have to do with blood clotting, are actually stickier in people who are depressed. I don't know why, but that's a finding that has been made over time. So there are, again, actual physical findings that go with depression that increase the risk of a poor outcome from coronary artery disease. We also know a few things that are positive. We know that individuals who are depressed who do participate in cardiac rehabilitation, and I've been privileged to work with a number of patients in that boat, and they get a lot out of it, not just in terms of their direct heart health, but in terms of their emotional health. And again, I think for a lot of reasons. They're doing something positive and proactive for their health. They're doing it in the company of other people, which I'll talk about in a little bit. Exercise certainly improves mood. There's a number of studies to support that. And stress management, which we'll talk about in a minute, also improves depression. So there are a lot of good reasons, and that's my commercial, for people to take it seriously if they're depressed or if a loved one's depressed in the context of coronary artery disease, and to get it treated. This was published within the last 2 years. I stuck with things that are quite current. The Cleveland Clinic Journal within the last 2 years. So what are the keys to treating depression? Because I've said a couple times it's really important if somebody's depressed to treat it. And actually there are a range of things that have been shown to be helpful. And all of these are supported by research that's been duplicated over time. Earlier, that one diagnoses and treats this condition, the better. That's true for most things in medicine. There are a number of medications that are safe and effective. Almost too many. You can't get through a half-hour show on TV without seeing 3 antidepressant commercials. But there are a number of medications. The most commonly prescribed in the United States are what are called SSRIs. The granddaddy now of these is Prozac, which has been around for 20 years, but a number of others as well. There really isn't one that's better than another. There's sometimes one that's better than another for this individual, but appropriate medication. These medications, when they're prescribed, need to be taken every day. We try to educate people that you don't just take them on the day that you're not feeling good. They're maintenance type of medications. Psychotherapy or counseling, talking therapy, if you will, has been shown to improve outcomes. People who are depressed, who are in counseling, get better faster. They get more better, if that's grammatical, which I don't think it is. But psychotherapy and counseling added to medication, that's 1 + 1 = 4. That gets people further, faster. I just mentioned cardiac rehabilitation. That's been shown to improve outcomes in people who are depressed with coronary artery disease. Their mood improves in line with their participation in cardiac rehab. Appropriate exercise, whatever your doctor, your cardiologist has signed off on you being able to do, it's going to improve your mood. Good nutrition is part of the program today, and it certainly has an impact on one's emotional state. I think we all know that. But particularly this one, avoidance of alcohol. Why? Because alcohol is a central nervous system depressant. People may take it as sort of an anesthetic to numb their emotions, but the ultimate impact is negative. If you rate people's mood in association with drinking and cessation of drinking, there's a negative connection. Okay. Drinking in moderation, I mean, that's a different topic, but people using alcohol as an emotional anesthetic is really a bad idea. And this is one that I preach a lot. And in fact, the longer I've been in psychiatry now for 20 years, the longer I'm in it, the more I preach this, is people contact. I actually give homework to people that I want you to come back and show me in a little notebook how many people contacts you've had in the last week, because there's a direct correlation. And people who are depressed isolate themselves, but the more people contact you have, the more positive impact on mood. There's a positive impact on your immune system. We're social beings. We're meant to be together and to interact. And what I hear from people, and I understand it, is, yeah, I'll get out there when I'm feeling less depressed. And what I say is getting out there is one of the keys to you getting less depressed. So that will move us along to part 2. So that's my pitch for people getting adequately screened for depression and adequately treated for depression, because it's good for their heart. The other thing that's good for your heart has to do with your state of mind. And I think, again, everybody here knows this, but sometimes we need to remind ourselves of what we know. Anger, hostility, and high levels of stress are not good for us. And so a picture's worth 1,000 words. It won't surprise you that it is far better to be this girl than this guy. Okay? Now, dropping back, I live with this girl, all right? And I can say, although this is in San Francisco about a year ago, although she looks peaceful and relaxed here, not always. I mean, let's face it, she's 17. But better to be in that state than in that state. I mean, who would you rather hang out with of those two? Really? So let's talk about optimism and cynical hostility in heart disease for a moment. Many of you have heard of or remember type A personalities. And we don't talk about this that much, and the people have poo-pooed it a little bit. But I went back to read on this because I didn't know the history of the type A personality. It was actually first described by a couple of cardiologists in New York, Friedman and Rosenman, way back in the 50s. And the reason they caught on to the fact that many of their patients, and again, these are cardiologists, had these high-strung, stressed-out type A personalities, is they noticed that the seat cushions in their waiting room were wearing out. Because people were just so kind of fidgety and stressed, and it's like, why are we having to replace the upholstery every 6 months? They had all these type A, and this is in New York, they had all these type A Wall Street types who were having significant cardiac issues. And so they ended up studying this, and they came up with the idea of the people that are type A. And they noted it to be a risk factor for coronary artery disease. So type A folks are workaholic, stress-driven, time-conscious, impatient, tightly wound, and controlling. Now, none of us knows anybody like that, right? I'm really glad that we don't have any doctors on our medical staff with any of those characteristics. So their work was widely published, also highly criticized, probably highly criticized by type A people reading it, but still, I think made some really, really valuable points. And in fact, the research that's been done in recent years tends to support the findings of these two guys that they came out with 50 years ago. So this was published in the Journal of American Cardiology in 2009, so pretty current. And what they did was a meta-analysis. And I'll tell you briefly what that is. A meta-analysis is a study where you take a whole bunch of other studies. So you look at research that's been published by, in this case, 25 different groups over time, and you lump it all together. And you run some really high-power statistics on it to say, okay, what do we pull out of this if we throw all of the data from all these studies together? So they looked at 25 studies showing, and they showed that if you, again, control for everything else, smoking, cholesterol, exercise levels, all of that levels of anger and hostility put people at increased risk of coronary artery disease. And they had scales, sort of psychological scales that measure how hostile people are, how angry they tend to be a higher percentage of time. And what they found is that individuals who already have coronary artery disease, who are carrying high levels of anger and hostility, have poorer outcomes. Think about those two pictures. Which of the, aside from the fact that one's a 17-year-old girl, which of those two people are you thinking, yeah, a little more risk for some heart problems? It's the angry guy, right? So to put it in the parlance of current 17-year-olds, it pays to chillax. This was published, again, in the Journal of Cardiology. Well, none of us, myself included, get through life without ever feeling hostile or angry. I mean, I don't see the Dalai Lama sitting in the room here. So those are emotions that we all get. But we're talking about over time, kind of your approach to life over time. Another study getting at the same thing from a different angle. There was a major study that's had a large impact on how medicine is practiced in America, called the Women's Health Initiative. And some of you are familiar with that. Involved 100,000 women and followed over 8 years, and unbelievable amounts of information obtained that speak to things like breast cancer risk and screening and to use estrogen, to not use estrogen. A lot of data came out of the Women's Health Initiative study. But one of the things they looked at is psychological scales on that measure optimism or cynical hostility, which I love that term. Optimists had a third fewer coronary events, angina, heart attacks, etc., and significantly lower mortality, again controlling for other factors. Also, optimists who have bypass surgery have a lower rate of being rehospitalized. So their outcomes are better. Being optimistic pays off. And that was again published within the last 2 years in the journal Circulation. I don't know if this is surprising anybody, probably not, but again, it helps to underline things that we kind of already know and to say that what you think you know is accurate. It pays to be optimistic. So, how do people do this? Well, there are a number of ways to do this. And I'm not going to prescribe what's right for you, but again, let's look at and maybe brainstorm a little bit. What are things that help one to stay optimistic and to cultivate patience and to cultivate, calm, if you will? Certainly, and it should be on the list as a separate thing, but I kind of included under spiritual retreats, spirituality. However that is practiced by a person tends to help both of these traits. There, I suppose, are religions that preach hostility and cynicism, but not most, thankfully. And so faith and spirituality. I wrote some specific resources that speak to this. Being in Balance and other titles by Wayne Dyer, who's a psychologist, easy to read, engaging, and does a nice job addressing kind of approach to life. And how one actually, in real time, works with one's mental attitude. A classic book, available in paperback or at the library, called Feeling Good by David Burns. David Burns is a psychiatrist out of Harvard who's written a lot about the impact our thoughts have on our emotions and what we can do with those thoughts to change our emotions. It's very practical, it's very readable, it's very well done. A guy I've come to like in recent years, Jon Kabat-Zinn, he wrote a book called Full Catastrophe Living that speaks to this. Kabat-Zinn's a psychologist who did a lot of work at the Sloan Kettering Cancer Center. He's worked largely with cancer patients and looking at the impact of prayer, contemplative prayer and meditation on immune function. on recovery from cancer. Also applies to other conditions, including heart conditions. But very, very well written. And he also has some really cool CDs. I think these are available through the library. I know they're available at Barnes & Noble, where he kind of talks through. And what's interesting about Kabat-Zinn, because he's a very relaxing guy, and he kind of coaches you through how to bring yourself down when you're feeling stressed or impatient. And he coaches you through some meditations. But he's from New Jersey, so he does it with this really broad Jersey accent. It cracks me up, but it's really it's fun to listen to. For people who kind of struggle with this over time, it's their style. Getting in with a good counselor or a good therapist can be very helpful. Somebody who ends up functioning kind of as a coach and helps support you while you make changes in how you respond to stress. So counseling and therapy. And then a number of other things that I'm guessing maybe weren't as available in Holland, Michigan 30 years ago, but are now. Yoga. Great. And there's a number of places around here. Tai Chi. There are a number of places that offer that. Spiritual retreats, and again, looking at what might be available through your faith community. And others, meaning use your imagination. But those are all decent resources. And summarizing that doing those things has been shown to have a direct positive impact on your heart health. And with that, I'll conclude, and I'll be around for when we get to questions and answers.